All right, welcome everybody. Travis again here. Got another great topic today. I love today's been amazing so far, and I think all of our topics have really tied into each other. I was in Nadia's and I was in Jen's. I did miss Mish's. Say that 5 times fast, but a lot of them spoke about the questions you should be asking your clients on your pre-screeners and stuff like that, and conveniently, today's presentation with Thea is literally the 10 questions you should be asking your clients. So it's literally going to tie in all together and put a little bundle around everything, hopefully. Again, guys, thank you very much for being here. Thank you, Thea, for giving up your time today. Those of you with your cameras on, Pam, and everybody, do you mind? We'll get them off for this particular part. Thank you very much. Don't forget, guys, sharing your stuff on Instagram, writing the reviews for the presenters. I'll get some of those links down there for Thea in a moment, but I might as well throw to Thea. Thea, thank you again, and yeah, I can't say it enough.
Pleasure. Thank you so much for having me. I was just, we were gas bagging away before you all joined. And it's just been an absolute pleasure to be involved with not only two guys running a session all about vaginas for the whole day.
There's your first vagina,
I know it's
everybody.
about more
the first
than
vagina from Thea.
We could do a count, actually. I would so like to see that go. No, sorry, don't. Yeah, it's been a pleasure and just so good to be able to get it all together so quickly. It's just amazing. I'm going to just let everybody join. It would be an awful drinking game. It's about the 100th. We had, don't even start me. Right, I'm going to turn off the chat because it's just going to distract me and I will just get sidetracked with all the banter. So here we go. I'm going to start sharing my slides and then make all the jazzy stuff happen. Hopefully, let's go there. And we'll get started. So I'm just going to tell you just really briefly, and I'll try and be brief about it, a little bit about why I speak in this space and where I've really come from with regards health and women. And, you know, I started in the health and fitness game probably 10 years or so ago now, after my own experience of doing what women do, which is, or sometimes what women do, get pregnant and have kids. And the adjustment process for me, which got super messy, both physically, emotionally, mentally, all of the ways, relationship wise, that was also chaos. And for me, I found myself again once I got myself fully lost in becoming a mum. I found myself through movement, and for me that choice of movement was swimming was always my passion. And through retraining my body, my postnatal body at that point in time, I started to find out who I was, this next iteration of who I became. And then, you know, long story short, moved to Australia, broke my foot just before my first nationals experience in the pool over here, which was gutting because I'd only just figured out that I was actually quite good at swimming at the ripe old age of, I don't know, 30 something, and ended up spending my first winter in a plastic cast in Australia. So for an English person to have a plastic cast on, sweating their way through summer, and I couldn't obviously swim, so I trained myself on the deck of my first house in Australia. And I remember lying there looking up at the beautiful Australian blue summer sky, sweating to death with my bright pink plastic cast on, thinking, oh, you know what, you know, maybe I won't go back to my corporate HR world that I left when I became a mum. Maybe I could retrain, and I could be a personal trainer, and I could train other women to help find themselves out the other side of motherhood. And that's how I started my journey in this space. Very quickly, and with Mish at the time, and which is why I can tease her about her time management skills, or lack thereof, because she's a very dear friend of mine. And I started working with her, started doing group pregnant and postnatal classes, absolute chaos, children running around everywhere. Loved it, and then hated it quite quickly. Just too noisy and too much for me. And my kids had just started to go to school, so I started to see a different stage of my own life and that experience. And I guess I started to see what these women was presenting with week after week in group, and then in individual sessions. They would show up and they would say to me, Thea, fix this. And they would like stick their body in front of me and go, fix whatever various part that they would complain about. And you know, I really struggled with that because I never saw them as broken at all at any point in the process. But then fundamentally, I was just like, actually, it's not about this physical stuff so much. And I realized very quickly I needed to kind of change my skill set, and did a lot more coaching qualifications on top of what I already had studied in my HR postgrad work. And then still that wasn't quite enough. I was dealing with too much mental health in amongst all of that. So I went back to university here in Australia and studied a master's in counseling. So now I do this really amazingly blended work. I still run a studio and do body-based work. I still call myself a personal trainer. I can still write a half decent program if I'm pushed to it. Probably nowhere near as good as most of you guys these days, but I do a lot of blended body-based therapy, as well as specializing a lot in trauma. So I do a lot of talk therapy. I run my own private practice. I subcontract to a trauma clinic. I do my body-based stuff, and I get to talk to guys like you about how we can do this work holistically so much better. So I guess that's a really long intro, and hopefully that's given everybody time to get the cup of tea after Mish. But that's where I come from. I come from this space of, okay, so you guys know some stuff now. And now after today's amazing sessions with Nadia and Jen and Mish, you have a much greater understanding of some of the detail and some of the stuff, right? The science. I want to help you ask your questions better of your clients, and how you can work better with these women. So I am going to make this really simple for you. I'm giving you some questions, and we're going to talk about what answers you might look for. And yeah, just heads up, you're going to get way more than 10 questions. So, and I can't promise how many vaginas you're going to get, but there'll be a lot. So heads up from the outset, there are going to be some generalizations in this session. So please know that there are exceptions to everything I'm going to say, because every single person you see is a unique human with their own stuff on top of what it is you already know that is in your now expanded science understanding, right? So when I speak about guys, I'm not talking about all men, I am not talking about all women. And I really want to flag the fact that it's not always really binary pink and blue. When I talk about women today, I'm talking about every woman who identifies as female. And when I say men, I mean all men who identify as men. So please know that I am very, yes, I try to be very aware of those intersections, and it not being quite as simple as we might think that it is, even though hopefully after today you realize it's quite a lot more complicated than you probably even thought. So that's my warning. Women aren't the same as men, and now after today I'm quite sure that I do not have to bang this drum anymore. You know this, right? You know that not only physiologically, anatomically, from a genitalia perspective, which I hopefully have made that super big on your screens now, we have different bits and we have different ways of thinking about things, and our worlds are very different. How we experience the world is very, very different, and it is it's really complicated because it's also related to our lived experience. And as a woman with female anatomy, I can say that my lived experience is very different to my partner's, who is a guy who has boy bits. Okay, and the intersections and the challenges that I face as a female are really different to those that my partner faces as a guy, and that is absolutely like almost amplified in a gym setting, in a health and fitness space. And as you know from all of the stuff that you've heard today, it's a historical thing we're battling. So I need you to know that there is like layers of history, decades of stuff that goes behind all of this. And the female experience that you see today rocking up in your gyms and in your on the parks, because we're, you know, COVID, outside and all that stuff, wherever you're seeing your female clients right now. And the reason that I feel so passionately about this work, and I know that Travis and I did that session, a little Facebook Live the other day, is because I want you to really spend time crafting those conversations, because that is your, like, talking from a business perspective, that is your gold, right? It is the place where if you set up those interactions well from this start, you will have clients for life. First of all, you'll see them through multiple pregnancies, different stages, ages and stages of their life. You'll start training. This is how old I am. I now start working with my clients' children, and actually, weirdly, grandmothers, but that's a whole nother thing. We have this capacity to hold space for clients, and that to me is the valuable work that we do as health and fitness professionals. We are so much more than people who really understand push-pull, cardio, core, how to put a program together. There is so much more to our skill set than that. I will bang on about this so much in the next hour. I want you to come out the other side of this a better coach and an amazing human, rather than just like an interrogator of questions going, okay, well, I've got to do my pre-screen thing. I have to tick these boxes off because that is going to ensure that I am, acting ethically within my scope of practice, not breaching my insurance or whatever that is, operating within the guidelines of Fitness Australia and all that stuff. Totally valid and super important. I want you to do all of those, but I want you to do it in a way that shows that you understand the world that woman has come from. And so that is why you hopefully now have this arsenal of amazing information, courtesy of the other guys today and all of your other learning that you've done. And now I want to, as Travis said, tie that up all neatly for you so that you can go, okay, now this is what I need to be able to do when I interact with these women. How am I going to have these really tricky conversations? And I'm going to put it out there. Some of these questions might seem really straightforward, and some of them are going to challenge you, and I suspect there to be, and if I could have the video and the audio on at that point, and I'm not encouraging you to do that, it'll probably break the internet, but I would hear a collective intake of like, oh my gosh. So we're going to start off basic and we're going to get into some meatier things as we go through, but please also know, I want you to understand that I would want you to ask these questions of any of your clients, not all of them. Some of them are very much specific to a woman, and you wouldn't ask them of your male clients. But a lot of these questions, I would encourage you to ask your male clients as well. The reason, though, you would ask your female clients is different, and that's the nuance I want to get across today. So what you are trying to understand from your female clients might be very different from your male clients' experience. I'm hoping that I'm making sense with you. I hate not being able to see you and get like nods and yes, dear, I understand. So that's the space that we're coming from. So I'm going to just rattle through my 10 questions. Like I said, you're going to get more than 10. And actually this time I've framed it with an extra bonus question at the end. So we'll see how we go. Question number 1. What does your typical day look like? Now, I've crafted these questions really very carefully. I have used very specific language, and where necessary, I'm going to explain why I've asked these questions the way that I have. The first thing I want to say is that if you do group sessions, like I'm aware that a lot of you will be doing like group boot camps or group classes, and you don't necessarily have a system that allows you to, sit down with a client and do a big, long pre-screen conversation. There'll be a lot of you that do one-on-one work. I want to encourage every single one of you to really try and rethink that model. And I want you to advocate for yourself as professionals in this space. Your time is really valid, and your clients would, I think, and from my experience in the health and fitness industry, happily pay you to sit down for a session. I do an hour and a half. You might be able to get through it in an hour if you don't gas bag as much as I do. And actually sit down and ask these questions, as well as all of the ones that you have to ask, right? Like, have you had heart attack, and what's happening with your blood pressure, and all of those things that we know we are duty bound to as ethical and good health and fitness professionals. But to understand the world that your clients are living in, I would really strongly encourage you to think about your I call it an intake session, but whatever you want to call it, your intake session in a slightly different way. And this, for me, has to be done as a conversation. You can't just piff this out on an email and expect clients to be able to engage with these conversations, because they need to be phrased in a particular way. You need to think about your body language and how you're going to actually receive this information. This is my very deliberate starter question. What does your day look like? Because just because they're refusing to make any assumptions, right? I don't want you to assume that just because they look like they're of childbearing age and they look to be carrying a bit of weight, that they're coming to you because they've had a baby, right? Like, that's a horrible position to take, standpoint to take, right? Just because they, I don't know, look like they're over the age of menopause, that they're like really old and decrepit and they've got, you know, bone degeneration already happening, and that they're not very physically active. You know, I want you to understand your client's world, so you aren't going to be making assumptions from the get-go, and you want to make it clear from the very start that you care about them as an individual, right? This isn't just another woman that you're ticking through your boxes and you're going, yep, she's got female bits, this is what I need to do with her. I need to remember their pelvic floor. I need to remember that if she's had a baby, that I need to remember these things. It's actually because you want to understand the world that they live in. It's a good opening question because it gets your client comfortable with you. They're going to start to go, okay, well, actually, this person cares. Oh, if this person cares about me, maybe this is a safe place that I can offload some of the things that I'm really worried about, the concerns I have about my body, or some of the that I've had at moving my body in the past. Maybe it's going to enable me to kind of break into other things later on that I really actually have held on to for so long, like I'm weeing myself, or all these other things we're going to get into in a minute. But it's setting a scene, it's encouraging your clients to feel safe with you, and it is showing that you're an amazing human, because you are. But again, it gives you this insight into their movement patterns. So for example, if they're a tradie, what are some of the things you might need to consider, right? If they're lifting heavy a lot, maybe you want to do different stuff with them. Maybe you need to really work on their flexibility. Maybe they are super strong, but they're not like cardiovascularly fit, and you need to do this with them. If they have spent their time nursing babies, look at that poor mum at the top mum to your left. Don't make me do that. I'm not a group fitness instructor. Like, if that's your life, that's a different kind of experience, and we need to ask questions about that. So what does your typical day look like? How do you spend your time? What a beautiful opening question to have with a brand new client. And then you're going to ask, so how are you sleeping at the moment? And this is, again, another one I would want you to ask your male clients, because it's really, really important, right? Are they getting up in the night for a wee? Are they co-sleeping? Are they pregnant and they're super uncomfortable and there's a whole bunch of other stuff going on? Are they breastfeeding at the same time? Are they like trying to contort themselves so that baby can feed? And is there space for a husband in the bed? Or partner, what does that look like for them and their whole life, right? Because that they're a complete person. There's a lot more going on than just a woman wanting to do whatever she wants to do with her body with you. Are they getting a good night's sleep? And what is enough sleep for them? And you're going to hear this a lot with me. Know your stuff, but what is normal for them and what is enough rest for them, right? Because we know that, what is it, 8 hours or something? I know that if I get 8 hours, I probably still would quite like another extra hour and a half. If you're a PhD 60 person and you're a diplomat like me, you'll know that like waking a diplomat up before 7 is a really bad idea, but I still might have had 7 hours sleep or 8 hours sleep. But if I've woken up early, that's very bad for me because I will be grumpy, and that will be a whole day of grumpy. And if I rock up like that to a session with you, you're going to have to really coax me into doing something, because I'm not going to be in a very good space, and that will have carried me through the entire day. So what is that person's normal and what works for them? And what isn't working, obviously, when it comes to sleep. And some of the reasons why I really want you to understand sleep is, for me, rest and recovery is paramount. You cannot work a depleted system. And if your client rocks up with bags under their eyes, they're on their 5th coffee of the day, they've got a screaming baby, they've maybe forgotten even to tuck their boob in their top or whatever, and you know, I'm going to be saying, let's just get some bean bags out and let me have the baby. Actually, am I even allowed to do that under current COVID guidelines? Probably not. Once all of this stuff gets sorted out, I would take the baby and wrap her in a blanket, put on a yoga nidra track that I work with, wrap her up in blankets, and take that baby for a walk and leave her to sleep for an hour. Like, that to me is the best care that I could give that mom in that moment, rather than going, okay, let's just do this session and carry on. Also, from that sort of starting point, if I have a woman, I always remember one of my clients who rocked up to me with her 6-week-old for her initial consult. And it was when I was working from my home-based studio a few years ago. And so she was sitting at my dining table, and her little baby boy, just this cutest little bundle, fast asleep for the whole hour and a half. And we sat and drank tea, and little, I think I can say his name. Can that be ethically okay? Yep, you're not ever going to see him. Little Hendrix, because it's such a cool name. Little Hendrix is asleep in his capsule by the side of me, and we're sitting there talking, and she just suddenly bursts into tears, and she says, I just cannot fit into my jeans yet. And I'm like, I'm sorry, what now? Like, you're 6 weeks postnatal. And she said, I just thought that this would be different. I thought that this is what happened. And I remember talking to her after she'd had him about her first little one, about, is that reasonable? And, I'm sure that you've all just kind of heard that so many times from your female clients, like this expectation to lose weight really quickly. And I could get into a whole societal rant about social media and blah, 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 and I'm not going to. I'm staying off my soapbox for now. But she had to be talked down off this cliff of what was a reasonable expectation for her in terms of weight loss. Hendrix was an amazing sleeper. Baby number 2 comes along, and I work with her the entire way through. She's hell-bent on having a baby really quickly. So 18 months later, she has a little girl, and Georgia comes along, doesn't sleep for toffee. Now, in between Hendrix and Georgia, lost lots of weight, all good. She was really happy. She got into her jeans eventually, and safely, and, all of the things that Thea would do. And she just loved this body that she had in between her pregnancies. And then this baby came along that didn't sleep. And she's like, well, I'm not losing my weight like I did last time. And I went, oh, really? Are we surprised? Like, this is a different baby. This is a baby that doesn't sleep. This is baby number 2. You also have Hendrix to look after. You've also moved house since that last time. And then we started having this really big in-depth, because this went on for months. I'm not losing weight here. It's just so terrible, managing all those expectations and goals. And that became the focal point of our time together. Why am I not losing this weight? And I said, listen, when you start sleeping, your body will relax enough to believe that it's not in the middle of some World War II crisis, famine, COVID, pandemic nightmare, and actually allow you hormonally to reset and to consider losing weight. If that is such a priority for you, which I recognize that it is, like, I'm fully empathizing with her and understanding that this is her goal, and I'm validating her experience, but I'm also saying, frankly, young lady, you need to just give your body a break. And once you start sleeping again, I promise things will change. What happened? Eventually, this little bundle of Georgia Joy did eventually start sleeping, and the weight started to come off. Not because she started doing anything particularly differently, but because her system had a chance to reset. So I am all about setting really clear expectations with clients and letting them know that until you can get sleep right, we are setting ourselves up for a really, really hard journey. And it is something you do not need to do. Your body needs to rest and recover and all that kind of thing. Now, I know I'm talking very specifically about a mum who's a newly postnatal mum, but that conversation I would have with any of my women, regardless of whether they are pregnant, postnatal, never had children, menopausal, postmenopausal, all of the things. I would still have that conversation around sleep and why it's important. Insight into those postural issues and pain points, because obviously if you're sleeping all hunched up with babies in the bed, that's going to lead to a whole range of really complex painful conditions that not only are going to impact what they're able to do in session with you, but fundamentally what they're able to do outside. Like, we need them to be able to carry on with their lives functionally. That's the primary focus of our existence on this earth, right? Is to be able to do our life living it well. So what can you do to help them work on some of those sore parts and release and train and strengthen some of the other parts that need working out. And obviously you want to know because you are an amazing human and because you care. So I'm going to keep on, and trust me, you're going to be stitched there for me by the end. Then I would always ask, sorry, those images are a bit rubbish quality. What exercise do you enjoy? What does movement mean to you? What do you enjoy doing? And the bonus follow-up questions for that is, if they look at you and they go, well, I don't really like the gym, or I've had this failed experience in a gym before, or whatever it is, and you're going to go, okay, well, what did you enjoy as a child? What did you do? Team sports? Did you do individual stuff like me? Did you swim on your own? Like, it's super competitive, like competitive brain that I've got going on, but don't be putting me in a team setting because I'm all about me, right? So, but then again, using my PH360 language, if you're one of those little connector types and you need a team thing going on, you're going to change your prescription based on this information that you're gathering, right? You're not doing anything radical at this point. You are just having a conversation, but it is going to inform how you're going to program for this client and what you're going to suggest option wise. So like, do they need to come and do a group session with you, or would they be so much better off just working one-on-one with you? Is it better that you work one-on-one with them in the short term, but then stick them in a group setting? Like, what's going to work for them, because they are an individual female client. What's changed for them over the years? When did they fall out of love with movement? Ever like have a passion for any kind of movement? What did they enjoy as a child? What movement do they enjoy now? Like, what could you do in terms of changing up what you do if you work one-on-one with clients and you've got that capacity? Sometimes just going for a walk is amazing. Could you work outside for them sometimes? Does it mean that you need to, if they tell you that they hate burpees, how do you feel about that? Like, is burpees like an integral part of your training plan? Like, I don't know. You're the trainer, but you need to understand what you can offer this client, but what's going to really get them coming back. Because fundamentally, we want our female clients moving more often, safely, obviously. But they need we want to encourage that sense of just loving moving their bodies again. And sometimes we need to get a bit creative with our female clients because they have this historical perspective of exercise not being for them. Oh, I'm not a sporty person. Sport is exercises for those, other cool girls, or the fit mums, or the yummy mummies that they see at school, or whatever it is. What are the stories that they have got going on in their heads? Did they come from way back when they were a child? Because trust me, you are going to be battling from a motivational perspective. You're going to be battling all of that as you work with your clients. So what do you need to do to meet their needs, right? Well, to start with, you need to ask them some questions about understanding what they enjoy and what their needs actually are. I'm just going to see if I just check the chat box and see if there's anything that I need to be across. So giving me a pause. Chatters. Oh, sorry for the English accent. Okay, good. I haven't said vagina very often, actually, Jono. Not yet. It's coming. I get vagina pictures and everything soon. Now, I'm not going to spend a huge amount of time on this because I know that you had done a whole session with Nadia, but this is a question that I ask my clients, and I will ask all of them that I think are of period having age. Okay. I am not going to make any assumptions unless they are quite clearly, because I have a 75-year-old client. I'm not going to ask her, but I will ask her, when did she stop having her periods? That's another slight nuance change to that. But I will ask this question of everybody: are you having regular periods? And then now, because you have this amazing information from this morning session, I want you to now change this around. Okay, not throw any of that amazing information from Nadia out, hold that here, but understand what your client's normal is, right? So what is regular or not for that client? Okay, because if they say, no, I'm not having regular periods, you're going to go, well, when did that start? And what do you mean by irregular? Is that you have really always struggled with settling into a pattern? Because then my brain goes, okay, well, have we got any question marks around PCOS? any endometriosis type problems going on. We are building up a picture of things. We're not doing anything with that information at this stage, and you're not diagnosing them with anything. You're not having to treat anything. You're just starting to build up this picture, and you're going to write yourself notes, right? Like you're going to go question mark fibroids, question mark PCOS or PCOS, depending on where you come from and how you say it. I don't know which is the English way and which is the Australian way, but anyway, what is your client's normal? Because what my normal is now is not the same as what my normal was 10 years ago. What my normal is definitely not what textbook normal is, that 28-day thing. And I know that you will have nutted that out today with Nadia. And again, this periodization for periods thing, I'm not going to cover. Oh, somebody's got their noise on. Okay, can we just check that everybody's on mute?
Oh, here. Did you get your thing?
Is anybody, could someone, Trav, are you there? Can you just mute everybody for me?
Yes, sorry, I'm also on mute as I'm talking. Hold on, I'll figure it out.
Okay, thank you. Sorry. I can hear somebody trying to navigate little people, I think, for which I have huge sympathy. So yes, I'm not going to talk massively about periodization for periods, but you need to know what your client's preference is for that training cycle. Okay, so we know that at different stages of a cycle we are potentially going to get greater strength gains, and I know that, and I'm apologizing here because I didn't have a chance to see Nadia's session today. I was in the clinic, but the way that I work with this is that I know the research base that we currently have, which is actually, just a heads up, always evolving, because we are now starting to see people research more and more into women's health issues. Whole different rant that it may even have touched on, but we don't have a huge wealth of research in this area because people haven't historically researched women's health related issues, particularly around exercise and training, and particularly at the elite end of that, okay, and its impact on periods until very recently. So we understand what we know currently, and it's
Sorry, just I'm trying to wait for your little pause, but you're powering through. Your slides aren't on.
Yes. Have they gone off? Sorry guys, give me a second. Where is it all gone? Bear with me a second. I'm going to have to close that, do that. Now are they back? We should be back. Are we back? Sorry guys, pressing too many buttons. So going back to that periodization for periods, how I work with that with my clients is that I say to them, I know what the science says. What is it like for you? So, you know, for me personally, I know that the science says I should feel like I want to curl up in a ball on day one of my period. But for me, once I've started bleeding, I am like, yes, now I'm feeling good and I really want to start moving again. My funky bit is just before my period starts, okay? But different women will respond in different ways. So take the science and the research and please stay up to date with that, because like I said, it's constantly evolving. Stay up to date with it, but listen to what your client says and ask them. And I have this conversation every time they come into a session. What day is your period? What day are we on right now? What do I need to know? And is that normal for you? And has that changed? Because I'm pretty sure that you told me in your intake that, you know, you're a 28-day regular as clockwork kind of girl. What's going on in your life generally? Because if now we've pushed out to 32, what's going on? Like, is there something I need to know? Is there anything you want to talk about? How can I help you as my client understand what's going on with their bodies? So we want to open up that space. Now, just notice my questions have built up quite gradually, right? Like, what does your typical day look like? How's sleep for you at the moment? What exercise do you enjoy? Now we're going to go into periods and then it's going to get funkier, right? So they're getting a bit more comfortable with talking about this stuff, hopefully by now. And I want you to think about the fact that part of your job is to educate your clients, because most women don't really understand their periods very well. Terrifying thought, right? A lot of women have a lot of shame and taboo attached to their periods. If they've had a horrible experience of their periods since they started bleeding at 8 years old, which is a client I was working with yesterday, just talking about their relationship with their periods is just traumatizing for them, and they hate talking about it. So you do want to engage in this really sensitively, but you also want to be able to provide them with information. They may not have a space to be able to ask, is it normal? Like, I don't know whether this is normal. Should I be bleeding for 10 days straight? I don't know. Have you always been bleeding for 10 days straight? Is it super heavy for those 10 days? And how much of a break do you have in bleeds? You know, ask all of these kind of questions, but power them up with knowledge so that if things change, like that client that I was saying is regular as 28 days, but now it's pushing out to 32. We want to encourage that woman to, maybe if that's a regular occurrence for, I don't know, 3 or 4 cycles, maybe we, depending on their age, and we're building up this picture of them, right, and their history so far, do we want to encourage them to go to their GP or gynecologist to just get a bit of a checkup? When was the last time you had your pap smear, right? Like, there's all of these things that then start to become part of this conversation, and we want to encourage our female clients at every stage to take ownership of their own health, because historically that's not been the case. Historically, and I'm trying not to be too gendered about this, but historically it's been men who have been responsible for this stuff, because men have historically been our gynecologists, they've been our doctors, they've been our researchers, and they hold the information. And women just kind of go, oh yeah, the only reason I really need to know about my periods is so that I can have a baby or avoid having a baby. Right? Like, that's what we're kind of taught at school. And let me tell you, the education that we have hasn't changed very much. Like, I have teenage girls, they're not getting taught any differently at our schools in Australia right now. I can't speak for New Zealand and other places, but it's still not a conversation that's being had. It's not something we talk about in biology lessons, because it's all, ew, it's gross, blah blah blah, all of that stuff. So we have fully fledged adult women who have had children who don't really understand their periods very well, and they don't know when it's time to get help and to seek referral to other specialists. So we want to encourage that. And as ever, you want to be an amazing human, because that is your job. First and foremost, you are an amazing human. So then I would ask my female clients very specifically and in this way, have you ever been pregnant? And I phrase it that way on purpose, because that is quite a sensitive way of asking about pregnancy. It doesn't presume anything. And for a lot of women, we want to, as my little minion says, we need to proceed in this space with caution, because we don't all have a really great experience with pregnancy. We may have expectations placed on us to have been pregnant before now. We may have never wanted children, and we have people around us expecting us to want to have them. We may have had rape or sexual assault that led to pregnancy, and we don't really want to admit or talk about that in any great way. We may have lost babies. So I would then follow that up with, if it was an indication that they, you know, didn't follow that with, no, I haven't had any pregnancies, I'm not interested in that right now, or whatever, you know, they're very kind of like, oh, that's cool, great, we don't need to talk about it anymore. But if they are in any way hesitant, or we get a vibe that there's something else going on here, look for body language reading, like what's their eye contact like, are they being able to kind of engage with you, what is their body telling you if they suddenly just shut down and now they're fiddling with their hands and they're looking a bit awkward. We're coming into this, what, question 5, like we've kind of warmed them up gently, right, at this point. So are you comfortable talking to me about this? Is that okay? Is it okay if I ask you some more about it? I don't want to go into something that's deeply uncomfortable, but it's going to make my job so much better, and I'm going to be a much better trainer for you, a much better coach, if I can understand what your body's been through. So we can then follow up with, you know, how many pregnancies have you had, and when was your last pregnancy? So if we have women who have a history of miscarriage, stillbirth, who have had round after round of IVF, and all of the emotional upheaval that goes with that, we want to be really sensitive and engaging very gently with this conversation, not just making an assumption that because, you know, they're coming to your postnatal class, or they're coming to whatever class with you, that, you know, they must be this kind of woman who's had children or thinking of having children, or, you know, that they haven't got pain in their story. I just really want you to engage at that human level from that very, very outset conversation. And another one I like is sort of, where are you in your baby making journey? For the people who you've got wind of that they've tried and it's not working particularly well, and then you do your research in this space, and then you can become part of their trusted team of people who can help with, you know, that experience for them. So if they tell you, okay, well, we've been trying for 6 months and nothing's happening, you can go, okay, well, what kind of things have you noticed? Like, are you tracking your cervical mucus? And if they don't understand, and if everyone's just gone, ew, Thea, you're talking mucus, that's like next level. That's way different to vagina. Like, vagina is easy. If you can slip vagina into a chat, cervical mucus is a whole nother issue. But if you want to talk about, you know, have an awareness that you know, our mucus changes during our cycle, and it's an indication of whether we're ovulating or not. It's also an indication that we've got an estrogen dominance going on at different points in the cycle. So we're going to start to have this building up these layers of information. How educated, how widely Googled, I was going to say widely read are your clients, but how widely Googled are your clients? Do they know this stuff? And can you help educate them on their journey? Can you point them into contact with people that you know locally that can help them? What naturopaths have you got? What homeopaths, traditional Chinese medicine gurus have you got? Acupuncturists? Like, who are the people around you? Where's your local IVF clinic? Like, all of this stuff you need to have in your arsenal to be able to engage with these women week after week, year after year. Because like I said, I've got clients who I have worked through 3 pregnancies, 4 pregnancies with, and then I end up working with all the various family members. We want to continue to maintain those relationships and work with them through the various stages of their female life. And I'm sure that Nadia has talked about stages at various points in time today. Question 6, tell me about your pelvic floor. Nice open question. Tell me about your pelvic floor, because you got an instinct straight away for whether they even know what a pelvic floor is, right? Straight off the bat. You will get a feel for how they feel about talking about their pelvic floor. Like, if there's been birth trauma, for example, there may be a whole bunch of psychological trauma tied up with that part of their body. And if you start to see them like literally clamp up, you can guarantee that part of their body is also super tight. I'm quite sure that Mish will have mentioned pelvic floor function, whether it be hypertonic or hypotonic, so whether it's weak or overly strong. So we want to have a feel for what is going on with this woman. And because I do this from a body-based perspective, the works that I do, like visually watching what my clients are showing me, they're telling me so much from their body. I'm looking at what their feet are doing, what they're doing with their knees when they're talking to me, how tense is the rest of their body, because if they are like switched on and clamped up like a little clam, I can pretty much guarantee that pelvic floor is like up there and squished to within an inch of its life. And I would be working on a lot of down training, even without referring to a pelvic health physio. I can make those kind of educated guesses after working with hundreds upon hundreds of women now. But we want to be able to see what this client knows. What does this woman know about her pelvic floor, and how comfortable does she feel like she's going to be to talk about them? And then this is where you go with that, right? Do you feel like you can hold on in a queue? And you really need to be, can you hold on if there's a queue at the shopping center? Probably not so much of a queue at the shopping center at the moment, but anyway, that's giving you an indication around urgency. Are you leaking when you cough, sneeze, laugh? And they'll always joke about it. Can you go on a trampoline? How's that going? That kind of thing. So we've got that kind of stress-based incontinence. Then I'm loving a poo chat. Always will ask about poo. Have you ever had a poo accident? And you'd be amazed how many women will then just launch into a story about poo stories, especially if they've got little kids. Like, poo is like a really good conversation topic. And then if you're not getting a feel for like any kind of awareness and whether there's any connection with that part of the body, then I'd go somewhere like, you know, do you feel any heaviness or dragging down there? Because if they're not comfortable with vagina, that's where I would go. I would always use vagina as a go-to, always anatomically sound language every time. But is there heaviness or dragging there? Do you feel it at different times of the day? Is there a particular time of day at the end of the day normally where it just feels heavy and you've got some kind of dragging sensation? Does it feel different first thing in the morning when you're well rested and gravity hasn't been acting on your pelvic floor for the whole day? Because that then is a little alarm bell that I would want to encourage a referral to a pelvic health physio to just see if there's any prolapse going on. And again, we don't want to make assumptions that just because they haven't had children, that their pelvic floor isn't under any kind of pressure or ever hasn't been under any kind of pressure. It is like an information gathering exercise at this point. And then we're going to make some educated guesses and suggestions from that point on. And as I've said, it's going to inform the programming that you do. And what you will or won't be prescribing from an exercise perspective. So what was that? Question 6. Then I go here. Are you having regular sex at the moment? And this is the one that I always have the biggest reaction about, because yes, I really do ask that question. And I ask it for a whole bunch of really valid reasons. Not just because I am nosy and like talking about sex with people, but and I know, because I can't like read your faces right now, especially the guys in the room. But there's this often like, Thea, why on earth would we want to ask that? That is like A, deeply personal, and B, not something that is within my scope of practice as a personal trainer. Like, what if they think I'm hitting on them or whatever? If you've got, I find this definitely easier to ask my early postnatal clients, because it's often a topic that they want to talk about, but they don't know how to talk about it, because you don't want to own it in front of your mother's group that, you know, you haven't had sex since you conceived your baby. But you want to be able to open up the opportunity that they would feel comfortable to have that conversation with you. Not, again, to compare how good sex is with their partner versus you. And it's not about gossip, right? It's actually gives you an incredible insight into your client's world. It helps you know if there is any pain or discomfort that might require a referral. So for me, it's a way of saying to a woman, was it painful before? Did you have, before you had children, did you ever have painful sex? Because if they say yes, then I'm like, okay, what on earth is going on with these poor women? Because it's far more common than you would possibly imagine. I would want to be referring to a pelvic health specialist that specializes with pain, pelvic pain. If it's more painful since they've had children, okay, so what happened in the birth? Tell me about the birth. And that's when I would go fully down that angle and talk more about what happened. Did they have a second, third, fourth degree tear? Is there an issue with lubrication vaginally? Because, and I know Mish has been talking about her juicy muffins, vagina muffins earlier, because I saw the chat. But you know, is there a lubrication issue because they're breastfeeding, right? Like, there is some really valid reasons as to why we would want to have this conversation. And often, because I mean, I say there that women deserve to be having good sex, we all totally do, but also that there aren't that many safe places to have this conversation, because oftentimes we don't want to sit there with our friends and go, you know what, I'm having really shit sex. And I come to this from a really personal space. I explain to all of my clients, because I'm that kind of open book, that I hadn't had sex with my the husband of my kids, the father of my kids, who was my first husband, since I conceived our son. And that was a whole psychological thing for me. But had I been able to talk to somebody about it, I would have found out that I had not recovered very well from a pap smear, cervical pap smear procedure. I could go into it in huge amounts of detail, but I won't. that I hadn't recovered very well from that treatment, all because nobody asked me that question. Are you having regular sex? They had asked me, how is sex for you? Making an assumption, these specialists, these gynecologists had made this assumption that I was having sex, which I thought was lovely, just because I was married and I had children, that I would be having regular sex. They'd made these assumptions, and I could just go along with the fact that because I was ashamed and didn't want to admit that I hadn't had sex with my husband at the time for 4 years, you know, I could just go along with their story. I could just say, well, sex is fine, thanks, because it was. I didn't want to have sex with him. So actually it was fine. But it wasn't, because I would really have liked to have had some good sex, and I wasn't having that. But also I had this condition that really needed treatment and didn't get resolved for many years after, purely because I had not been asked the right question. So sometimes, and so this is why it's so important, sometimes asking those really uncomfortable questions can open up a whole avenue of healing for your clients that you never thought possible, and it gives them a space to share with you what's going on in their world. And I'm sure that there's chat about this, and I will look in a minute, but I'm aware of time, so I'm just going to keep plowing on through, and I will come back and do the questions at the end, I promise. Then I would go somewhere like here. How do you feel about your body right now? And I do that because I want to get an insight about what on earth is going through this woman's head about their body at whatever stage they are in their life. How do they feel? And I don't want to make assumptions. It's so important. I don't want to make an assumption that because my client looks like they might get on a pair of scales and do a BMI thing and they would be classified as overweight. I'm not going to make an assumption that they're here to lose weight, right? Because I've worked with far too many, unfortunately, sexual assault and rape victim clients who deliberately carry more weight post their assault to keep them safe, because that makes them feel safe. But I wouldn't want to presume that that's why they're there with me. I don't want to presume that every woman who looks like they're here to lose weight is doing it because they don't like their body. What if they actually really love the body that they're in? What if that is amazing and they just want to be stronger? Or what if they're there with you because they want to be more flexible? Or what if they're there with you because they just want to connect with other women in your group class and enjoy moving their bodies? Like, please don't assume that, you know, because we love moving and we love getting stronger and moving our bodies in this incredible way, because that's the world that we live in, that is the same world that your client lives in. And I want you to be able to speak the way that your client sees the world is the way that they will engage in conversation with you. And having some of these big, broad conversations is what connects you to them. It helps educate and empower them. It helps break down some of that fat shaming that we have in society. It helps obviously inform your programming, because most importantly, you want to find out what their goals are. So I would always ask my clients, what are your goals? And I feel so strongly about hearing from them, building up this beautiful picture of their world, of all of the things that have played a part of their story that has led them to be this woman in front of you. I want you to be able to set aside your stuff, what you would typically want to do with them, and find out what matters to them. Yet again, no assumption being made here. I talked to you about my sexual assault clients and rape victims. We want to assume that, you know, they have got this message that being strong is bad, or that being strong is great, or being overweight is bad, or being overweight is great. What if we just find out what their goals are? And this is your way of like checking up with yourself. Have you been paying attention to this conversation? Take yourself to one side, to like have a word with that inner I was going to say inner therapist, that's my clinical brain kicking in, your inner personal trainer head, and just kind of go, forget about what you would normally just prescribe for a woman of this age with some of the physical stuff that you know is going on. What matters to this woman, and can you help them can you help reshape those goals? Like, I'm not saying say no. No, I know that that's what you want to do. You want to lose weight and you want to get back into your pre-pregnancy jeans and blah, blah, blah. But actually, we're going to do this. I would always go, I can totally see why you want to do that. And I can see why that makes such a difference to you, that you, A, don't have to go out and buy a new wardrobe, but B, that you feel some kind of connection to the body that you had before and the person that you were before you became a mother. But hey, guess what? We're a different version of you now. And you can be a fitter, stronger, more zen, balanced woman than you were on the other side of pregnancy. Your body is going to constantly evolve and change. You are never going to be the same person ever again, because you are always changing and the world is always changing around you. How can we do your life better? And what can I do to help you live your life better without pain, more functionally? And all of these kind of big questions are kind of getting you to this place. Have you been paying attention to your clients' needs? Now we're coming into land, which is timely, I think. Then I always say to my clients at the end of my chatty part, before I do any kind of postural assessment, before I check for abdominal separation, for any kind of connection to core, before I check what's going on with breath and with ribs and with hips, before I do any of that funky stuff, I will ask them, is it okay for me to touch you? I'm going to get your permission, and I will continue to get permission. Physical contact, I believe, is just paramount in the work that we do. It needs to be done sensitively. I speak a lot around trauma-informed practice of personal training, because that's the world that I work in as a trauma specialist, and I am acutely aware of the damage we cause other people when we aren't asking for consent. But I believe 100% in a body-based approach. It's why I'm a somatic, a body-based psychotherapist rather than a clinical psychologist. I chose that very deliberately because I believe that physical contact is so important. It helps me do my job better as a personal trainer. It helps me do my job better as a therapist when I'm working with a physical body, but it needs to be done sensitively. And I'm going to keep on asking every time I go to touch that woman's body to kind of say, it's this muscle that we need to work. Can I just cue you and see if we can draw attention to your rhomboids? That's what we want to work with you today. I'm going to ask before I do that. I'm just not going to presume that because I've asked once, I have permission forever to go, I'm not talking about manhandling them, obviously, it's respectfully, but it's that kind of importance. I need you to be so aware of the power of touch. It builds connection, it can bring healing, it's so valuable. But please, please, please continue to ask for permission. And if they're not happy, we need to respect their goals, their needs and their wishes. And so this is my bonus question. I will throw in for free. How is your mental health? I think it's really important in the work that we do. I cannot separate physical health from mental health. We are a complete unit. We are one system. And if one part of our body is off, if one part of that system is off, I can guarantee that there's a knock-on effect, a flow-on effect somewhere else. If a woman has had a traumatic birth, I can guarantee that there's going to be some physical trauma. I can almost always guarantee that there's going to be psychological trauma. And you don't need to diagnose them with a mental health condition. You do not need to do anything with that piece of information except be mindful, seek advice if you need to, ask locally and build up referral networks with your private mental health clinics. I know that in the work that I do, I speak in private practice, and I train other clinicians about the value of doing this blended approach to work. And if we could have a team of trauma-informed personal trainers out there to help bolster the work that we do with clients, it is such a valuable resource, which is why I speak so much about this stuff. But importantly, for female clients, we know that gender is a critical determinant of mental health. We have a historical story with that, right? Like, we're hysterical. We have this traveling womb. We don't, right? Like, we know that now, right? But back in the day, that's what they believed, and it made us a bit crackers and crazy. And then we would get sent to asylums because heaven forbid we would want to have sex, or then we'd have doctors come and service us, and I'm not even kidding you, actually bring us to orgasm so that women would calm down and be more regulated. So there's this long-standing historical story here, which means, for example, that with depression, women are twice as likely to be diagnosed than men. And that I could literally get on a whole soapbox about that. But we also know that women particularly struggling with mental health, only 2 in 5 people will seek out therapeutic support. Only 2 in 5 people will go and get a mental health referral plan, or go and pay for their counselling privately, or call Panda or call Lifeline when they're feeling wanting to end their lives. But they will go see a trainer. They will go move their body. So if we can ask that question, we can help that client get well, their whole body well. Because if you have a shredded body but your mental health is in the toilet, you are not a well person. You are not whole person healthy. And our job is part of that puzzle. We need to collaborate and work with others. Absolutely. I'm not saying you will need to go out there and become fully fledged clinicians and therapists, but it is your job, I believe, to ask the question. You don't have to then work with that mental health, but you do need to know that, for example, if you've got someone who is highly anxious or suffering PTSD or very depressed, your role is going to be quite different. You might have to support them very differently than you would a client that isn't struggling with their mental health. And also, just a FYI, personal trainers are not exempt from mental health challenges. So we need to spend work in this space. I feel like I have literally drunk too much coffee today. I'm going to stop my slides and my questions there. I've never gone through that so quickly in my day, so I hope you've all been able to keep up. Travis, is there lots of stuff? Are there lots of things that I need to check in the chat box?
No, we're not too bad. We're not too bad. We're going to have our panel discussion coming up. So I think if anyone's got sort of those general questions, maybe we'll save them for the panel, because I had a couple of general questions myself. But what I want to point people in the direction of, Thea, as you guys have got through here, delves into that psychological side of things, delves into that trauma side of things, and spoke about some of that stuff. So if that's stuff that you want to learn more about, and that's stuff that you maybe, whether it's a personal issue or whether it's a client or whether anything like that, Thea's details are there. So please reach out to Thea and touch base with Thea. I have put her details for a Facebook review, as well as Instagram and all that sort of good stuff there for people who want to, leave a review for the presentation today. But apart from that, Thea, thank you so very much for your time. That was awesome. I know you plowed through those questions very quickly.
So sorry. I know there was so much in there. I'm really sorry, everybody.
People will be able to get it on the replay and watch it on the replay. And I'm sure they'll have to watch it over a couple of times, like all the presentations today. But what we'll do, guys, I'm just going to add the link now in the chat, which is going to direct you over to the panel discussion. Thea, thank you very much. You're joining us for the panel as well in a moment. If you need to get a quick break and head straight over there. Everybody else, please head over to the panel. And thank you very much again, Thea. I can't say it enough. And we'll see you over in the panel. Everyone get your questions ready. Hopefully an awesome discussion with all of our great presenters today. Thea, thank you very much.